First they think you're crazy, then they fight you, and then all of a sudden you change the world.
She was Silicon Valley's golden child, a billionaire by 30, backed by power players and promising to revolutionize healthcare with a single drop of blood. But Elizabeth Holmes's rise was built on a lie.
The onset of disease in time to be able to do something.
How did a Stanford dropout convince the world her impossible technology was real? And why did so many investors, politicians, even the media fall for it? This isn't just a story about fraud. It's about the dark side of ambition, the cult of disruption, and the moment $9 billion came crashing down.
Ms. Holmes, please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Chapter 1. The Prodigy. Our story begins not in the gleaming innovation hubs of Silicon Valley, but in Washington, D.C., where Elizabeth Ann Holmes was born in 1984. From an early age, it was clear she was driven by an extraordinary, almost singular, ambition. Raised in an environment that highly valued achievement, she reportedly idolized legendary innovators and entrepreneurs like Thomas Edison, driven by a profound desire to change the world and leave an indelible mark. She was a precocious child, intensely focused, often spending time alone, designing inventions and sketching out ideas for how to make a significant impact. Her academic excellence paved her way to Stanford University in 2002, where she enrolled in chemical engineering. But the traditional path of academia, with its slow pace of research and peer review, proved too constraining for her accelerated vision, in a move that would later draw comparisons to tech legends. At the remarkably young age of just 19, Elizabeth Holmes made the audacious decision to drop out of Stanford during her sophomore year. She took the money her parents had set aside for her education, her trust fund, and used it as seed capital to launch her own company in 2003. She initially called it Real-Time Cures, but soon rebranded it as Theranos, meant to evoke therapy and diagnosis. Her pitch was mesmerizing in its simplicity and profound in its implications, a revolutionary, miniaturized blood testing device that could perform a comprehensive panel of diagnostic tests, everything from early cancer detection to cholesterol levels, from infectious diseases to diabetes markers, all from just a few precious drops of blood, collected painlessly from a finger prick. This promised to eliminate the need for large, intimidating needles, multiple vials of blood, and the lengthy, expensive processes of traditional laboratories. It was a vision of democratized healthcare, of empowering individuals with immediate access to critical health information. Investors, particularly those steeped in the disruption-focused ethos of Silicon Valley, were instantly captivated. She possessed a compelling narrative, the brilliant, young female founder challenging an archaic medical establishment. She had the vision, a promise of a healthier, more accessible future.
The onset of disease in time to be able to do something.
She had the story, the college dropout chasing a dream. And perhaps most importantly, she radiated an almost unnerving self-confidence, a deep, resonant voice she reportedly cultivated to Project Authority, and an unwavering conviction that her technology would fundamentally change the world.
First they think you're crazy, then they fight you, and then all of a sudden you change the world.
She dressed the part, adopting Steve Jobs' signature black turtleneck, cultivating an image of a singular, uncompromising genius. This potent combination allowed her to quickly secure early funding, laying the groundwork for what would become an astonishing, yet ultimately fraudulent, ascent. Chapter 2. The Rise. The nascent company, fueled by Elizabeth Holmes's magnetic personality and audacious claims, quickly began to attract serious attention. Far beyond the initial circle of early-stage venture capitalists, Theranos became the darling of Silicon Valley, a shining example of disruptive innovation poised to tackle the staid, bureaucratic healthcare industry. The company's board of directors became a veritable who's who of American political and business luminaries, lending an almost impenetrable shield of credibility to Theranos. Esteemed figures like former U.S. Secretaries of State George Shultz and Henry Kissinger joined the board, alongside former senators and retired military generals. Their presence, largely ceremonial and without deep scientific oversight, served as a powerful endorsement, signaling to potential investors and the public that Theranos was legitimate, groundbreaking, and beyond reproach. This powerful network allowed Holmes to tap into an extraordinary well of capital, raising over $700 million from a diverse array of investors, including some of the wealthiest and most sophisticated private investors in the world, such as Rupert Murdoch and the Walton family. At its absolute peak, between 2013 and 2014, Theranos reached a staggering valuation of $9 billion. Elizabeth Holmes herself, still in her late 20s, early 30s, was celebrated as the youngest self-made female billionaire in the world, with a personal net worth estimated at $4.5 billion based on her majority stake in the company. She graced the covers of prestigious magazines like Fortune, Forbes, and Inc., becoming a media sensation. She delivered captivating TED Talks, appeared at high-profile conferences, and was a frequent guest on business news channels, always articulate, confident, and utterly convincing in her presentation of Theranos' revolutionary technology. The company secured partnerships that seemed to solidify its position as a transformative force in healthcare. A monumental deal with Walgreens, one of the largest pharmacy chains in the United States, promised to roll out Theranos wellness centers within their stores, making blood testing more accessible to millions. Another lucrative, though ultimately unfulfilled, partnership with Safeway involved a $350 million investment to build clinics inside their supermarkets. Silicon Valley hailed her as a pioneer, a visionary defying conventional wisdom. The media painted her as a genius, a force of nature. Yet, beneath this dazzling surface, behind the meticulously cultivated secrecy and the impressive list of influential backers, a dark truth festered. The revolutionary technology, the very foundation upon which this $9 billion empire was built, simply did not work as advertised. The core promise was a hollow shell, and the cracks in the facade were about to begin. Chapter 3. The Lie Unravels. Despite the relentless public relations push, the constant stream of positive media, and the glowing endorsements from its high-profile board, Theranos was, from its very inception, plagued with profound and systemic technical failures. The much-hyped revolutionary device, nicknamed Edison, a nod to Holmes's idol, Thomas Edison, was designed to perform a full range of blood tests using microsamples. In reality, it was deeply flawed, consistently producing inconsistent, inaccurate, and often dangerously misleading results. Tests for critical conditions like prostate cancer or diabetes would come back wildly incorrect. Patients were being put at risk. But Elizabeth Holmes, alongside her then romantic partner and chief operating officer, Ramesh Sunny Balwani, were masters of maintaining the illusion. Instead of confronting the devastating technical realities, they pursued an aggressive strategy of secrecy, intimidation, and outright deception. Employees who raised concerns, who questioned the efficacy of the machines or the ethical implications of using unproven technology on real patients, were met with fierce resistance. They were silenced through a draconian culture of fear, enforced by strict, pervasive non-disclosure agreements, NDAs that threatened severe legal repercussions for speaking out. Balwani in particular was known for his aggressive and intimidating management style, creating an atmosphere where dissent was swiftly crushed. The company operated in an almost paranoid state of secrecy, compartmentalizing information and preventing employees from truly understanding the full scope of the technological failures. Most of the blood samples Theranos collected were not, in fact, being run on the Edison device at all. Instead, they were secretly diluted and run on modified commercial blood analyzers, standard, off-the-shelf machines that were never intended for such tiny, diluted samples, leading to further inaccuracies. This was the dark secret at the heart of the $9 billion lie. However, the truth, like blood, has a way of seeping through the cracks. A few brave individuals, driven by their consciences and a profound sense of ethical responsibility, could no longer bear witness to the deception. These were the whistleblowers. Among them were Erica Changel, a young lab assistant who meticulously documented the pervasive quality control failures and the systemic data manipulation
in these tests, but we're still resulting them on patients.
And Tyler Schultz, an earnest young scientist who had joined Theranos due to his grandfather George Schultz's involvement, only to discover the horrific truth firsthand.
Even for me, I was working with these devices every single day.
Tyler Schultz, despite intense pressure and threats from Theranos' lawyers, courageously began providing information to a skeptical journalist. Their revelations, carefully and anonymously shared, finally reached the ears of John Carrero, an award-winning investigative reporter at the Wall Street Journal. Carrero, known for his meticulous and relentless pursuit of truth, became intrigued by the whispers of a cutting-edge health company shrouded in almost impenetrable secrecy. He began his own independent investigation, meticulously cross-referencing sources, interviewing former employees, often in secret, and digging relentlessly into the claims. He faced immense pressure and intimidation from Theranos' powerful legal team, but he persisted, driven by the gravity of the potential fraud and the risks to public health. The stage was set for a monumental exposé that would rock Silicon Valley to its core. Chapter 4. Exposure. In October 2015, John Carrero's tireless investigation culminated in a bombshell article published on the front page of the Wall Street Journal. The expose, titled "Theranos' Blood Test Devices, Feds Say, Are Flawed," systematically dismantled the carefully constructed facade, revealing that the company was not using its proprietary Edison machines for the vast majority of its tests, and that the results from the few tests run on Edison were unreliable. It detailed the systemic technical failures, the use of modified commercial machines, and the culture of secrecy and intimidation. The article sent shockwaves through the tech world, the investment community, and the healthcare industry. Holmes, initially defiant, went on CNBC's Mad Money to deny everything, claiming the Wall Street Journal's reporting was false and that the company had provided thousands of pages of documentation to refute the allegations.
We had sent them over 1,000 pages of documentation demonstrating that the statements.
She maintained her unwavering public persona, accusing Caro of being misinformed and pursuing a vendetta. But the house of cards, now exposed to the harsh light of truth, was already collapsing. Carrero's initial report opened the floodgates. Regulatory bodies who had perhaps been too trusting or too slow to react to Theranos' powerful lobbying efforts finally launched full-scale investigations. The U.S. Food and Drug Administration, FDA, began scrutinizing Theranos' unapproved devices. The Centers for Medicare and Medicaid Services, the federal agency that regulates clinical laboratories, found severe deficiencies in Theranos' lab operations in Newark, California, deeming them an immediate jeopardy to patient health and safety. The U.S. Securities and Exchange Commission, SEC, launched an investigation into potential securities fraud, looking into how Theranos raised hundreds of millions of dollars from investors based on allegedly false claims. The fallout was swift and devastating. Walgreens, which had invested millions in dedicated prime retail space to Theranos wellness centers, suspended its partnership in January 2016 and eventually terminated it. Safeway, another major partner, also cut ties after investing $350 million. Investors began to panic, and lawsuits began piling up. The media narrative shifted dramatically, transforming Holmes from a celebrated visionary to a suspected fraudster. In a desperate attempt to regain control and address the mounting regulatory pressure, Theranos made a stunning admission in May 2016. It announced that it had voided and corrected tens of thousands of blood test results from 2014 and 2015. Acknowledging their inaccuracy, this was a catastrophic blow to the company's credibility and a stark confirmation of the whistleblower's claims. The world now saw Elizabeth Holmes not as the pioneering genius she had meticulously crafted herself to be, but as something far more sinister, a charlatan, a deceiver, and a fraud. The dream had become a nightmare, and the reckoning was just beginning. Chapter 5: The Fall. By 2018, the once high-flying Theranos was in complete ruins. The partnerships were gone, the investors were suing, the regulators had come down hard, and the company was bleeding cash. In March 2018, the SEC officially charged Elizabeth Holmes and Sunny Balwani with massive fraud, alleging they raised more than $700 million from investors through an elaborate, years-long fraud that involved false or exaggerated claims about the accuracy of their blood testing technology. Holmes settled the SEC charges without admitting or denying wrongdoing, agreeing to pay a $500,000 fine, surrender millions of Theranos shares, and accept a 10-year ban from serving as an officer or director of a public company. This, however, was just the beginning of her legal woes. In June 2018, a federal grand jury indicted both Elizabeth Holmes and Sunny Balwani on multiple counts of wire fraud and conspiracy to commit wire fraud. The charges related to defrauding investors, doctors, and patients, alleging that they knowingly misrepresented the capabilities of Theranos' technology. The company, facing insurmountable legal fees and operational failures, officially dissolved and ceased operations in September 2018. Their trials became a media circus, attracting international attention and intense scrutiny. Holmes' trial began in August 2021, after multiple delays due to the COVID-19 pandemic and her pregnancy.
Ms. Holmes, please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
During the highly publicized proceedings, prosecutors presented overwhelming evidence of deception, including internal emails, text messages, and the damning testimonies of former employees and investors. Holmes herself took the stand in her own defense, a rare move for a defendant in such a high-profile case. She maintained her innocence, attempting to shift blame, and famously accusing Balwani of emotional and sexual abuse, claiming he had controlled and manipulated her. Balwani vehemently denied these allegations. After months of testimony and weeks of deliberation, the jury returned its verdict in January 2022. Elizabeth Holmes was found guilty on 4 counts of fraud, 3 counts of wire fraud, and 1 count of conspiracy to commit wire fraud, all related to defrauding investors. Crucially, the jury acquitted her on 4 counts related to defrauding patients, and could not reach a verdict on 3 other counts. This partial verdict suggested the jury believed she had defrauded investors, but perhaps not with the direct intent to harm patients, or that the evidence for patient fraud was less conclusive. In November 2022, after a tense sentencing hearing, Elizabeth Holmes was sentenced to 11 years and 3 months in federal prison, followed by 3 years of supervised release. She began serving her sentence in May 2023 at the federal prison camp in Bryan, Texas. Sunny Balwani, who had a separate trial and was found guilty on all 12 counts of wire fraud and conspiracy, received a slightly longer sentence of nearly 13 years. The once celebrated entrepreneur, the darling of Silicon Valley, was now a convicted felon. Her story transformed into a chilling cautionary tale about ambition unchecked by ethics and the devastating consequences of a lie. Chapter 6: Legacy and Impact. The spectacular downfall of Elizabeth Holmes and Theranos sent seismic shockwaves throughout Silicon Valley. The burgeoning biotech industry, and indeed, the entire venture capital ecosystem, it fundamentally altered the landscape, forcing a critical revaluation of how startups operate, how investors conduct due diligence, and the pervasive role of hype and fake-it-till-you-make-it culture in the tech world. The scandal raised uncomfortable questions about the cult of personality that often surrounds charismatic founders, particularly in an environment where speed and disruption are prioritized over proven results and regulatory compliance. It exposed how easily sophisticated investors, blinded by the allure of a transformative idea and a charismatic leader, can suspend their critical judgment and overlook obvious red flags. The Theranos case became a stark lesson in the dangers of Dunning-Kruger effect leadership, where a founder's confidence outstrips their actual competence, and in the perils of excessive secrecy and a lack of independent scientific oversight in high-stakes fields like healthcare. Elizabeth Holmes, once portrayed as a visionary, became a potent symbol of ambition unchecked by ethics. Her narrative now serves as a grim reminder that even the most compelling stories, the most promising technologies, and the most dazzling public personas must ultimately be grounded in rigorous science and unvarnished truth. The pressure to innovate, to achieve unicorn status, a valuation of $1 billion, and to constantly raise capital can, in extreme cases, lead founders down a perilous path of deception when the underlying technology fails to deliver. Yet, amidst the wreckage of Theranos, her story also illuminated the profound courage and integrity of the whistleblowers, individuals like Erica Chung and Tyler Schultz, who risked their careers, faced intense legal threats, and endured immense personal strain to expose the fraud. Their unwavering commitment to the truth, alongside the tenacious investigative journalism of John Carreiro, proved instrumental in unraveling the elaborate deception and holding the perpetrators accountable. Their actions served as a powerful testament to the vital role whistleblowers and a free press play in safeguarding public trust and exposing corporate malfeasance. Today, the legacy of Elizabeth Holmes and Theranos stands as an enduring warning. It is a stark reminder that in the relentless race to change the world, to revolutionize industries, and to achieve unimaginable wealth, integrity, transparency, and scientific rigor matter more, far more than mere innovation or dazzling rhetoric. The promise of a better future, however grand, must always be tethered to the unyielding demands of reality and grounded in verifiable truth. The lessons learned from the Theranos saga continue to shape conversations about startup governance, investor responsibility, and the ethical imperatives of developing new technologies, particularly those that impact human health. It serves as a stark reminder that no matter how big the dream, no matter how compelling the vision, the ultimate currency of trust can only be earned through unwavering honesty. Elizabeth Holmes didn't just deceive investors, she exposed Silicon Valley's dangerous obsession with fake-it-till-you-make-it. Theranos collapsed. But the real question remains, has anything really changed? Would another charismatic founder with a slick pitch and a big lie succeed today? Share this story. Question the next revolutionary idea. Because in a world obsessed with disruption, the biggest risk isn't failure, it's believing the hype.